Hi everyone! What I wanted to talk about in this video was taking the time that you need to address the issues at hand in your life. One of my friends is going to rehab this week and then is going to spend some time there working out his issues to help improve where he's at in life. I strongly feel, and I really despise any stigma around mental health. And I wanted to put out a message that if you are legitimately needing help, to pursue it and to feel confident in asking for it. I do understand that there's a whole maze of where the right help is. And there's also limits on what help's available. If you either start with your family doctor, or a pharmacist could also direct you to what is in the local resources where you could follow through and have a discussion about what's available. It's a really good starting point. And then it kind of depends on what government provides, and more it also is coming into play on what the businesses in the community have helped make available for supports. But I did want to be very clear that if you need to go get help, there's no shame in it. Whether it's for substance abuse or if you're struggling in life and you need someone there to sort it out, it's well worth your while investing in it. You know, one of the roadblocks I've heard different times is people saying that if it was someone else going through it, they would have the answer right away and would know the path to take. It's different when you're in the situation. Even if you're used to being the caregiver, it often takes someone else walking you through it in order to find a resolution and essentially to have peace. I wanted to touch on the topic of drug addiction for a minute. There are various pain medications available that are meant to help you through an accident or help you manage chronic pain. There can be a risk of getting addicted to these. There are medicines that are slow acting that then help you wean off of it if you find that you're addicted, or if you find that you're needing help cutting back. And they're done with dignity and respect. So where I live, there's a methadone program, and methadone just gradually goes into you. Then after 24 hours, it just sort of gradually drops off. And it's not that sort of spike that a hit of heroin or other strong pain medications would bring into the body that's fast acting and that more likely leads to an addiction. I'm not wanting you to be afraid of taking medicine that a doctor has given you. But if you're at the point where it's no longer needed, there's both group therapy and there are programs in place that will help you through and get you clean again and get you off the medicine if it's no longer medically warranted. And if you do need the help, you don't need to feel ashamed for asking for it. And although there's accountability when you're in these programs, and same when you're in the hospital, if you're asking for help, you do need to be honest, sincere, and genuine so people can get into your head and help you through the issues at hand. But if you're in that place of needing help, I do want to encourage you to get it and to take advantage of what's available. When I receive the medicines for the chronic pain I experience, there's a flyer that comes with it each time, and it highlights the symptoms of an overdose. It'd be really helpful for you to educate your family or housemates or people that you are commonly around of what these symptoms are, so that if you are experiencing an overdose while they're with you, they can get help for you and know the symptoms to look for that you would be displaying. And it's part of being responsible when you live with chronic pain. The other part of chronic pain is that it's an ongoing discussion, and it's not something where you go to the doctor once or twice over and it's dealt with. And that's kind of, I think, where people might get tripped up, where you have to continually be willing to talk about it and, tweak your pain medicine and be willing to undergo pain medication reviews and just keep working at it. Almost like it's in the context of a part-time job. So I just wanted to give you those few things to think about in this video. But I mainly wanted to give out the message that if you do need help, pursue it and feel good about investing in yourself and bettering your situation. Thanks so much for this time that you spent with me today. Bye for now.